Hi everyone, my name is Nicole Bahina and I'm with All Chicago, and I'm going to kick us off today as I usually do. Thank you for joining us for the COVID-19 update from the Homeless Service Division and the Continuum of Care. We have a lot to cover today if you want to go on to the next slide, but I'll just remind everybody of the housekeeping items. So we try to keep everybody on mute just to avoid any background noise. So please submit questions via the chat tool and we'll respond to questions after going through the slides. And just use the chat to notify us of any technical issues. We have a team of people who are trying to help troubleshoot today if anything comes up. Next slide. So we have a lot to cover today. We're going to pause after CDPH shares a progress report. We'll pause for questions, and then we'll pause again after the city talks about the COVID-19 response for individuals experiencing homelessness, and we'll take some questions there. And then we have a lot of content today on the continuum of care side of things about the expedited housing initiative, especially as it relates to coordinated entry changes. I will say that if we don't get through everything on the COC side today, this is not the only place where we're delivering that information. It's already started to be shared on many other places, so don't feel like you're missing out if you have to leave early today or anything like that, but we do want to make sure we talk about it a little bit today. With that, we can go forward to the next slide, and I'll turn it over to our colleagues at CDPH.
Hello, good afternoon. I'm Dr. Jasmine. Thank you for joining us again today. As we always begin, we usually start off with the current status in terms of the number of people who have been tested positive to date. And as of, this is from yesterday's latest count, or from the 29th actually, there were 20,499 cases of COVID-19 and 873 deaths in Chicago. That was an increase of 875 cases and 47 deaths since the previous day on the 28th. Next slide. For those who haven't had a chance to look at our website recently and really delve in all the resources available, we thought we'd share this with you. We're trying to share as much information as we can in terms of how the different demographic groups affected by COVID-19. And the first table lists the number of people who are positive for COVID-19 according to age and gender. You see it's about half of the people who test positive are female, half male. And then in terms of race, ethnicity, for the Latinx population, about 32% of positive cases are Latinx, about 40% are Black, 19% white, 3.6% Asian, 5.2 is listed as other. We still have about 30% of total cases that are still under investigation. And the next table, it talks about the number of deaths that occur, again, according to age, gender, race, ethnicity. And we see that here it talks about different rates. For the second column, that talks about the total percentage of deaths. For those who are Latinx and who died of COVID-19, they represent about 22.7% of the total cases of people who died. For those who are Black, they represent 54.2%. For those who are white, represented 17.5%. Those who are Asian represent about 4.7%. And then there are less than 1%, we didn't really know the race. And for the bottom table, it talks about for the people who died from COVID-19, the great majority of them had underlying health conditions. about 92.6%. So we know that this is something that we've been saying since the beginning as well. Having some kind of chronic underlying health condition does increase your chance of having severe illness, and the ultimate result of severe illness is death. That's why all the efforts that we're making to try to isolate those who are positive, and for those who are negative and high risk, we're doing our very best to try to shield them from contracting the disease. We also have a map on the right that shows the number of people who were confirmed to have COVID and died from COVID, and each dot represents a different race. And a bigger version is available on the website. Next slide. And so we've all heard about this effort to flatten the curve. And basically that means increasing the rate at which we see a doubling, or decreasing the rate at which we see the doubling of cases that occur. And you see that we are having some success in flattening this curve, all of the collective efforts made as a city. And I just want to thank all those who are working in the shelters with the clients. You're also contributing to this flattening. You see, initially we saw a doubling around every 4 days, increased to about every 8 days, further to 12 days. Now we're seeing a doubling every 19 days. Next slide. And so ever since we first started having the coronavirus website, is really evolved since it first started. And so this is a screenshot of what you would see when you log on now. It's really, with every day that passes, there's additional resources added. And so here are some of the types of things types of information that you would find. You would find official guidance from CDPH and also CDC. Any news, the latest news would be available there. Frequently asked questions, has proven to be very helpful for many across the city. Of course, there are links to the various data points in addition to the information that I shared earlier. If you want to read the governor and mayoral orders, we also have resources that you may find helpful, things specific to healthcare, behavioral health, housing, education, and employment, and food. And the other city departments also provide information, COVID-related information. So the Chicago Public Schools, the Parks, Department of Transportation, Department of Family and Social Services. And you can also find our hotline and email. It's updated every day, so it's a good idea to revisit it from time to time. Next slide. And this is a shot of the section dedicated to providing different types of guidances. If you look at the section that says congregate settings, there's a section dedicated to those working in the homeless shelters. And we have a screening tool available. I'm sure many of you are very familiar with it. There have been changes to the screening tool made, and the changes will be posted either later today or tomorrow, and we'll go over what those changes are during today's talk. Next slide. And just to remind you again, every day, if there are any specific questions that you have in mind, our health commissioner has made herself available to answer those questions during her live Facebook and Twitter stream. It's at 11 o'clock every day, Monday through Friday, usually most Saturdays as well. And you can submit your questions either on Facebook or Twitter using the hashtag AskDrReedy. Next slide. And And also earlier this week, we announced that we have a new app called the Chai COVID Coach. It's a free app, and you could register for it and download it onto your phone. The main thing is that if you think you are developing symptoms of COVID-19, there's a symptom coach there to help you provide specific guidance about how you can isolate yourself, ask information about not only yourself, but if you have other members in your household or your living situation. Like I said earlier, there's so many resources available on the website. Sometimes that might be daunting for some to sift through. This app really provides tailored information based on the information that you input initially. And then when COVID testing is available, and eventually antibody testing. So let's say last month you felt like you may have had COVID, but knowing that since 80% of people with COVID-19 recover, and a lot of people recover safely at home, you may not have undergone testing. So when the antibody tests are available, this app can also send you an alert and help you find your closest testing center. And also, this app can serve to help pre-register. So once a vaccine is available, it'll send you it'll announce that the vaccine is available and help you locate your closest center providing the vaccine. Next slide. Okay, and so every week we've been talking about some of the mitigation strategies that we've been implementing CDPH in conjunction with Department of Family and Social Services. We have different isolation and quarantine housing available, and we usually announce as they come online. We usually use the HAN alert to announce it, and there's a website that you can use to read about the different kinds of isolation facilities that are available. There is a new housing isolation solution that is actually coming online later. It came online today for soft launch, but will officially be available tomorrow. And I'll tell you a bit more later on in today's talk. And then there's also shelter guidance. Please visit the CDC website. There were some updates to it about how to prepare and respond to these, to how shelters, what they specifically can do to prepare and respond to the COVID-19 pandemic. All of you should have had a nursing visit where we came in and assessed to see if there are any locations that could possibly serve as a isolation area if anyone were to be tested positive for COVID-19. Also, infection control procedures were also reviewed, and we also reviewed the guidance. Please just let us know if you haven't been in touch with any of our nurses to review this material. Next slide. And also this week, or earlier, the governor announced that extended the stay-at-home order, but this time, starting today, is a modified stay-at-home order. So what does this mean? So wearing facial coverings is now required in places where you're not able to maintain social distancing. So this includes all indoor places like grocery stores, and then outdoor places where the social distancing is not maintained. Some outdoor activity restrictions have been eased, so the state parks, fishing, and golfing, you're now able to do some of that. Some retailers have been deemed essential where they weren't before. Retailers like greenhouses and gardening, pet services, and then other non-essential businesses, they may reopen for curbside pickup or delivery. And then religious gatherings can now take place if there are 10 or fewer people. Next slide. And so earlier I mentioned that the CDC updated what kinds of symptoms that we more commonly see in those who may be infected with COVID-19. And so it says that some of the symptoms, they may appear between 2 and 14 days after exposure to the virus. And people with these symptoms or a combination of symptoms may have COVID-19. So if they have cough or if they're experiencing difficulty breathing, you can place them under high suspicion for having COVID-19. Or if they have any of the two of the following symptoms, such as fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new onset of loss of taste or smell. If you have any two of these symptoms, you can consider them to be under high suspicion of having COVID-19. Next slide. So with the change in symptoms that are considered more common, we've updated our screening questionnaire, and it incorporates many of the symptoms that I just spoke about. I have two versions listed here. The main difference between the two is that one of them asks about subjective fever. Do you feel like you have a fever? The other one asks about a measured temperature. And the reason why we have two versions now is that most of the shelters have been invited to, we're distributing infrared thermometers. We're making them available, and they're going to be available tomorrow. You should have been reached out, I think it's Jess Lynch, reached out to you from and for you to confirm that you're able to pick up the infrared thermometers. Next slide. And then the testing in shelters. So this has been done in partnership with Rush, UI Health, and others, other medical staff to help organize the testing and to provide support for the various shelters that they've been able to visit so far. These rapid testing teams, they respond to any outbreaks in congregate settings. So if there are 1 or 2 people who test positive within a setting and we're alerted, the rapid testing teams are able to go and collect samples to test individuals to see if they're positive for COVID-19. The clients as well as staff are tested. And then if someone's found to be positive, if there's no isolation solution within the shelter, they're transferred to one of our isolation facilities. In addition, this is another opportunity to provide that tailored guidance for your facility for infection control practices, and to provide reinforcement if you are able to have an isolation area to just to review the proper infection control practices for interacting with those who are staying in that isolation area. So far, we've performed about 1,400 tests, and right now we're moving on to the next phase of testing, meaning we're expanding to sites without any active outbreaks. But in order to do that, we're ramping up our testing capabilities. So testing is basically the amount of testing we do is controlled by how quickly the labs can run the tests and how much of the materials needed, how much availability there is for those materials. So currently, for all the tests that have been performed, we are reviewing the data, and once complete, we will be sure to share them with you. And they'll also be available on the chicago.gov/coronavirus website. And so here just talks about clusters. So if you have 2 or more cases at your shelter, make sure you report it on our online form, which can be found on chicagohon.org/ /COVID-19. Next slide. As I mentioned earlier, the Southside YMCA is another isolation facility that is opening right now. So today it's in conjunction with Cook County Health, and today they're going to be accepting some of the patients who are being discharged from Cook County Health, and then starting tomorrow we'll be able to transfer clients from the shelters. So COVID positive clients, they'll be referred from shelters following testing from the investigation team. For each of the rapid testing teams that visit a shelter, there's a nurse that will be accompanying the testing team, and that person will coordinate the intake into the isolation facility. And so we're providing that support that is needed. We'll also be able to have transportation. We're still finalizing the details for transportation. So if it's not available this weekend, we'll work very hard to get it available during the week. Next slide. Oh, and also because we're making the infrared thermometers available, just want to make sure that you pay attention to, there's a guidance guidance form that will come with it. It gives you instructions on how to use the infrared thermometer if you're not familiar with how to use it. So it's basically once you turn on the thermometer, you would make sure that the person's forehead is accessible, so make sure they're not wearing a hat, or if they have bangs, to move the bangs aside, and then aligning the thermometer with the forehead, and then waiting a few seconds for the temperature to be read. And any readings above 100.4 degrees Fahrenheit or 38 degrees Celsius, that's considered a fever. There's no need to clean in between clients because it's not coming in contact with anyone's skin. And if you do clean it, you should clean it throughout your shift or once a shift, and you could do it either by using any of the cleaning wipes you have, or if you have sanitizer available. There's no need to wear any additional protective equipment that you have. The mask that you're currently supposed to be wearing would suffice because it's not considered a procedure that could generate any kind of droplets that will increase exposure to you. And that's it.
Thank you so much, Dr. Jasmine. We're going to pause here for just a few questions that I'm seeing in the chat right now that haven't already been responded to. One person indicated it looks like potentially a shelter provider received a call from a nurse at a hospital who was treating a client of theirs who had been hospitalized with symptoms, and they were trying to discharge them. She was calling to find placement and did not seem to know how to refer people to isolation housing, and the social work department did not either. And so this person was able to contact CDPH to get the proper information, but could you talk a little bit about how this information is being disseminated to the hospitals as well?
Yeah,
maybe throughout.
So earlier I mentioned the HAN Alert is a system where all the hospitals are connected to, and if there are any pieces of information that we need to share with them, we send it out through what's called a HAN Alert. And the alert could be a briefing on any changes in procedures. So if someone needs to be connected to isolation housing, we've sent alerts with the specific links they need to use, some of the criteria for the different housing, as well as the email address that they can use if they don't hear back once they've completed the forms. If you could tell me which hospital, I could just make sure to try to find out. Maybe they're not on the HAN for some reason, or the person checking the HAN hasn't done so. But I do want to make sure all the hospitals in the area know. So if you let me know, I can reach out to them. Yeah. Okay. Thank you.
Yeah, I think that's a really important point.
Yeah, it could be that individual person may not have known. And whoever is normally responsible for the transfer may not have been working that day, but I'll reach out.
Thank you.
Mm-hmm.
There are some additional questions around PPE availability and who the thermometers are going to. And, so the current, as far as I know, and I would ask All Chicago to jump in here too, because I'm not entirely aware of everything that you're making requests for, but this first push of PPE and the thermometers was really targeted towards congregate settings and drop-in centers and outreach teams. We have, I know at DFSS, started a conversation about thinking about what other housing providers might need as well, and how that could be coordinated. Nicole or anyone from All Chicago, do you have any other updates about PPE requests for non-shelter drop-in and outreach programs?
This is Nicole. I just asked Beth about that, and so I can maybe have an update later on in the webinar. Thanks.
Okay, thank you. I'm just going to check. I did not see a ton of questions. So I'll just do one final check before we move on. Yep, I think we're set. If you have any additional questions, feel free to put them into the chat. Dr. Jasmine, if you're available to just hang on until we get through the DFSS slides,
okay,
until we see if any questions come through, then we'll have another break for questions. Thank you so much.
Yeah, that's fine. That's fine.
Okay, so we can move on to the next slide. So hi, this is Maura McCauley from the Department of Family and Support Services with our Homeless Division. This week, we're really excited to announce that we're opening the Broadway Armory tomorrow morning, which will provide 200 beds for single adults of any gender. These beds are really critical to ensure that we can continue to sustain our shelter system at the social distancing levels. Once Broadway Armory opens this weekend, we will have a total of 700 beds at temporary sites across the city. And again, these are not new beds to the system. These are beds that are being brought online to help us fully decompress the shelter system and our current network of shelter beds throughout the community. Then over the last few weeks, DFSS and CDPH, along with our partners at Lawndale Christian Health Center, have been working with our congregate shelters throughout the city to assess and relocate clients who are at high risk of complication from COVID-19 to the individual hotel rooms that Dr. Jasmine was speaking about. So to date, about 140 clients in that high-risk category have been relocated from congregate facilities to individual hotel rooms. And we're really pleased that this week we have been able to bring in and tie in that group who, although they're coming from the shelter system, are also connected to the COC and our coordinated entry system. And so we are now, Lawndale Christian is working in coordination with the COC in this first wave to really reconnect people who may already have a housing match, but also focus on individuals in the hotel who still need a coordinated entry system assessment so that work can happen and that group of individuals can either move and reconnect with their current housing matches or be part of the system to be matched with housing down the line. Next slide. So just a reminder that calling 311 is still the process for connecting clients to shelters. The only adjustment to this process is that 311 is continuing to ask if the caller has been recently released from jail or prison so that they can just quickly identify if this person requesting shelter should be connected to resources for returning citizens Please continue to report any issues you're hearing about clients, or even those of you who are calling on behalf of clients who have trouble accessing the shelters through our DFSS homeless email address. We have been working very quickly with 311 to raise those issues up with them, and they have made some modifications to some past concerns that have been raised from people on this group. So please continue to do so, and just know that we're continuing to work through that. Next slide. And although we have really been operating in crisis mode for the last 5 or 6 weeks, I've lost track. HMIS is still really critical, and we know now that with the movement that many of our shelter residents the movement that is going on with them by now moving into isolation facilities or to Hotel 166. DFSS has been working with All Chicago to develop guidance for shelter providers on how to capture those transfers for isolation or for shielding placement in HMIS. And so your agency technical administrator will be receiving an email from All Chicago with more details. So if you are an ATA, please look out for that. And if you are not an ATA, feel free to reach out to your ATA to be kept in the loop on that. And then we are also working together with All Chicago and all of our temporary shelters to get all of those shelter beds and clients documented in HMIS. And it's really important that anyone who comes into your agency for emergency shelter, even for just one night, should be enrolled in your shelter project. Although there's been a lot of flexibility from all of our funders throughout this crisis, we will still be reporting, and the reporting is important for things like funding, for ensuring equity and looking at who's being served versus the needs that we are identifying through the system, and for a number of other purposes. So really thanks everyone in advance for cooperating with any of the new guidance that comes out related to HMIS. And there will be more to come on that. Next slide. So this is just a reminder that Catholic Charities is still continuing to complete the CDPH screener via the telephone for all shelter placements. We are still requiring shelters to continue to follow the CDPH protocol for new intakes and perform the screener at intake. So now that shelters should be equipped with thermometers, please review the guidance that is provided with the thermometers and the guidance from CDPH about how to incorporate those into your screeners. We are still making every effort to only transport residents to shelters without known COVID diagnoses, but we really need to follow this protocol at both ends of the process just to maintain everyone's health and safety as best as possible. Next slide. So we know that the need for PPE and cleaning supplies has been a top priority for everyone since the beginning of this crisis, and we are working to create a sustainable and consistent supply stream for shelters and outreach providers with whatever resources become available through the supply chain. The recent nurse visits that took place that we talked about last week really highlighted this for us. So really appreciate everyone for sharing what your needs are, and we're continuing to try to make those connections. As Dr. Jasmine mentioned, the thermometers will be available, and there is a bigger PPE distribution tomorrow. And so that, again, is geared towards congregate facilities, drop-in centers, and outreach teams So you should have received notification about this order and the pickups tomorrow afternoon at the United Center. But please reach out to the DFSS homeless email address if you have any questions or need any information about that. Next slide. We are also working with CDPH and medical partners to explore a coordinated testing and assessment shielding of high-risk residents at encampments, so really shifting this shelter strategy to individuals who are unsheltered. So we hope to have more information about that shortly. We're continuing the citywide canvassing with all of our outreach partners and continuing to work on the CTA with our outreach partners to provide education about COVID-19, to provide face masks to continuous riders, and to continue to offer shelter. And we are still maintaining the hand washing stations and porta potties that have been installed at some of the larger encampment sites. Next slide. Please continue to, if you're a shelter program, continue to update Catholic Charities with changes in bed availability, and please feel free to keep DFSS informed about any staffing shortages or changes in bed availability and your suspected or confirmed cases through the DFSS homeless email. But again, now that there are some other protocol with CDPH about how to report, cases and other instances like that, please follow that procedure first and then let DFSS know so that we make sure that you are getting the immediate assistance that you need and your clients are getting connected to the right resources. And then we will continue to coordinate on these webinars and communications with all of our partners. Next slide. So we are working very closely with the COC and other city departments to align COVID response resources to help us address critical needs of the housing crisis response, the critical needs of the crisis response system and efforts to advance the community's broader housing strategy. So this is really important, and as this is the last DFSS slide, so I'll just take a minute to say that in the next few webinars, we really want to be sharing some of the thinking and questions that we have about what comes next as we move into, as we move from crisis response into recovery, what those considerations are and what all of you are thinking about within your own organizations and what your needs are as we move forward with that. And our real intention is to be coordinating and folding in all of the work that's happening from the emergency operations standpoint at the city and all of our medical partners and wonderful partnerships that are happening to really coordinate that through the existing infrastructure that we have with the COC. So that's really what we're looking at in the next several weeks. So just wanted to share that and ask you to think about that and share with us what your organizational thinking is, as I know we're not the only ones thinking about that. So that's it for me, and I will pause here. And just maybe do a check to see if any questions came in for CDPH. Dr. Jasmine, there is a question here about if there's emergency shelter available for frontline workers. This person had an individual turned away from shelter because they're working at an Amazon warehouse. So this may require some more information offline, but then the follow-up to this question is whether emergency shelter, if there are emergency shelter who have behavioral health expertise for individuals who have no COVID exposure. So maybe if you could talk a little bit about any respite housing that is available for frontline workers. And I know you're also working on some behavioral health strategies as well.
Yeah, so we have isolation housing available for, not isolation, respite housing available for healthcare workers. So if you work in a healthcare setting in the city of Chicago, there are rooms available for you to stay in that because you're constantly exposed to COVID-19, and if you have concerns about coming home and exposing those you live with, those housing options are available. If a person who's working at Amazon, if they tested positive, we'd have to have a referral from whoever provided the testing. So if they had a primary care provider or if they were tested in the emergency room, that healthcare system should submit an intake form. And then for those with behavioral health expertise for individuals with no exposure to COVID, so someone who is not COVID positive but have behavioral health issues and they need housing. So that I would have to get back to you. There are programs available, but I just don't know them off the top of my head.
Right, and I think from the shelter perspective, some of our shelters range in expertise on site for behavioral health needs, and we have been making some resources available like the NAMI crisis line, and making even accommodations within the sites if people need extra space or other de-escalation support. So it really ranges throughout the shelter system, but this is a need that has been lifted up quite a bit in this COVID response, and I know it's something that your team is looking at in terms of behavioral health supports that could be broadened down the line. Okay. And then I think the only other question I see is whether there will be testing at encampments, expanding from the shelters.
So yes, plans are underway to begin testing at encampments. We're working very closely with DFSS to work with the outreach teams that regularly visit the encampments. So when our testing team arrives, that they'll be more welcome, and it's more like a warm handoff. So they'll be more likely to agree to get tested. As the plans solidify, we'll share the information with you.
Okay. I think that's all I'm seeing at this point for CDPH. So I think we can move on, Nicole. Thank you, Dr. Jasmine.
Yeah, thank you. Have a good day, everyone.
Great, thanks. Torlin, if you want to move to the next slide, I can kick us off. So we are trying to keep our information shared on this webinar to COVID-19 response-related items in these 4 buckets. If you go to the next slide, we'll just do a quick shout-out that's about maximizing financial resources for agencies sort of later on, and it's just a quick reminder that even in all of the COVID crisis, there is still a census. Things are changing related to the census, but it is really important that we work with our participants to try to get a response to the census. And so There's just a few shout outs here about that. Service-based enumeration for people living in shelters are on hold for now, and counting people living on the street is on hold for now, but these counts will happen. The date is TBD, so as soon as we know more information, we'll share that. But if you know people that have access to a phone or can access a computer, they can complete the census form online or over the phone. Next slide. And another quick reminder, today is the deadline for the second round of All Chicago's COVID-19 Homeless System Agency Emergency Fund. If you applied in the first round, you can still apply again, but please only submit one application per agency. And it technically is easy enough of an application that if you're just finding out about this now, you could still submit and get it in by 5. It's a pretty easy process. We'll drop the link to apply in the chat box. And just try to get it in before 5 today. Great, so I just want to do a quick reminder that a lot of what we're talking about on the subsequent slides fall under the continuum of care implementation structure, which is shown here. If we want to move to the next slide, most of the subsequent slides are going to talk about this COVID-19 Expedited Housing Initiative. So at last Friday's meeting, we talked about how the COC board adopted a policy to support expedited housing placements due to the COVID-19 crisis. And since the last time we've talked, we have put an accountability plan in effect, and it goes into effect May 4th. Yesterday, we did a more in-depth dive into this, and it's really only applicable to COC-funded agencies. So today we're just going to give you the highlights. If you missed the webinar yesterday, we have a summary and all of the information in our Slack channel. Next slide. And as a reminder, the committee that we worked with within the Continuum of Care implementation structure to review and approve the accountability plan is the System Performance and Evaluation Committee, which sits under the System Performance Data and Research line of work. Next slide. So the highlights, and again, you can access more information on the Slack channel, but the things to know is that it starts May 4th. The accountability plan will go into a place there. And if we go to the next slide, we can share the high-level expectations. So we are expecting every COC-funded agency to determine which HUD waivers to apply for that will help their program expedite housing. We have a lot of information on our website and continue to talk about this on our Thursday peer sharing webinars with housing providers. You'll hear a lot more about how coordinated entry is changing on the subsequent slides. For eligibility, there's no change in criteria, but we're asking that you use the HUD waiver for self-certification of disability. It's an important one, and hopefully will speed up the process of getting people housed significantly. And then when you're looking at your intake processes, please identify ways that you can remove barriers or get creative and use technology and social distancing. We have reached out to IDA, CHA, and the Low Income Housing Trust Fund, asking them for what waivers they've applied for and to provide guidance to providers. And so we should have more information to share next week on how that will further impact our ability to house people more quickly. Next slide. Great, and this is just a little bit more of what we talked about already, and so we can probably move on to the next slide, which is gearing us up for the coordinated entry conversation here. So again, if we show this system, the COC implementation structure, there is a coordinated entry leadership team, and they have approved a temporary prioritization plan and approved interim contract protocols. And so that's where this came from. And with that, I'm going to turn it over to LaShunda and Laura, who are members of our coordinated entry leadership team, and they're going to quickly walk through some of the things the group decided earlier this week.
Hi, Nicole. Thank you very much. This is LaShunda, and I'm going to give you guys a brief update on the Coordinated Entry Prioritization Plan. The Chicago Department of Public Health has identified households experiencing homelessness at higher risk of COVID-related medical complications who have actually tested negative for COVID-19 to be prioritized for housing services to shield them from contracting the illness. So what the coordinated leadership team decided, we approved a coordinated temporary prioritization plan on April 28th, following the recommendation of the Chicago Department of Public Health. Now, our team will meet to review this data regularly, and we plan on meeting on June 23rd to make any adjustments as needed or during our monthly meeting. Next slide, please. The priority population are households at high risk for serious illness due to COVID-19 and tested negative. However, we decided to set aside 10% of units, available units, to house the youth ages 18 to 24 with or without children. We also decided to set another 10% of units available for unsheltered households, and 20% of units has been set aside for families. Next slide, please. Now, the high-risk criteria is for those identified by CDPH as individuals at high risk of illness due to COVID-19, as those who are age 60 and older, or any age that has an underlying health condition. As you can see, we have listed those conditions below, such as moderate to severe asthma, chronic lung disease, poorly controlled diabetes, serious heart conditions, chronic kidney disease, and those who have been immunized compromised conditions. Next slide. Laura.
Hi, this is Laura Bass, also from the Coordinated Entry Leadership Team. So just a couple more notes about the set-asides. So as LaShonda mentioned, we have these set-asides for youth, unsheltered households, and families. But we also understand that those priority populations that LaShonda spoke of will also include some of these populations as well. So for example, a young person who is immunocompromised would fall into that primary prioritization. And then within these set-asides, we will also be prioritizing, households that are at greater risk. The 10% set aside for youth is part of our pre-existing prioritization for coordinated entry, and so that prioritization will continue. And then we do have these 2 additional set-asides for families and unsheltered households. Next slide, please. And the last piece we wanted to speak on is the need to maintain attention to racial equity as part of this temporary prioritization. So recognizing that systemic racism really impacts our system and the people that we serve, in particular looking at the disproportionate impact of both homelessness and COVID-19 on people of color. So the Coordinated Entry Leadership Team will be reviewing disaggregated data to ensure that people of color are identified, tested, assessed, and housed at a rate that is proportionate to their makeup in the population of people experiencing homelessness in Chicago. And then the team will also determine if it's necessary to make adjustments to the temporary prioritization plan to maintain that racial equity piece. Thank you.
Hello, everyone. This is Bridget Doviet with All Chicago. I'm a senior program coordinator, and I'm here today to talk about the housing provider interim contact protocol. Next slide, please. So what we've done is we've changed from 10 days of attempting to contact to 5. So we've cut it in half. Next slide, please. And I'm just going to give us the highlights of other things that we've changed. We've gone from, we've said 2 attempted contacts should be made in this time period instead of 3. And we have taken out contacting participants and households by mail. Next slide, please. So I just wanted to highlight here that if a household or a participant reaches out within 90 days from the original match and you've already requested a rematch because you could not contact them, you are able, if you have capacity, to have that household or individual rematched to you by contacting Chicago CES at CatholicCharities.net. So this has always been a policy that we've had, but I just want to highlight it here. Next slide, please. And then when it comes to households declining housing, we have come up with some new protocols here that if they are enrolled in projects that offer scattered site housing, then they are allowed to deny 3 housing options, and after declining those 3 housing options, they will go back onto the matching list. We've always had for the transfer policy that through coordinated entry that they can deny up to 3 housing opportunities, and after that they will not be offered another housing opportunity. And something that came out of the leadership team meeting, besides approving all this, is a recommendation that households that have declined SRO housing twice will not be matched to an SRO housing in the future. Next slide, please. So now let's talk about the timeliness standard. We have shortened this as well. We have also cut this in half. It has gone from 30 days to 15. Next slide, please. So within 15 days, we would like for housing providers to update the need status to one of these below, from attempting contact to attempted contact. And next slide, please. And if the housing provider does not update the need status during that time, or by 15 days, then we will rematch that household. The household will be placed back on the one list, and we will assume that you have an opening still, so then we will send you a new referral at that time. Next slide, please. So you may request an extension to this 15-day, and then of course if you update it, we don't expect you to house the client within 15 days. You get an additional 30 days, so it's a 45-day period overall. But if there is an exception, please do email chicagoces@catholiccharities.net and myself, B. Doviet, at allchicago.org, so the referral need status will not be updated by anyone in the housing provider. We are flexible during this time with you, as you are flexible with us. We just would like to get people housed as quickly as possible, and we appreciate your cooperation with that. So the email should include clear reasoning why the extension is being asked, and an estimated timeline, which can also be flexible on a case-by-case basis. Next slide, please. So before I get on to the expediting housing policy information for housing providers, I just want to tell you all that on May 4th, that's when all of this will be starting with the timeliness standard, and your ATAs will start getting emails, and they may, because it's through SQL, start getting emails for matches you had prior to May 4th. And you should feel free to just ignore those emails for any matches made prior to May 4th for the timeliness standard. So we are just moving forward from May 4th and then going onward. We're not going to backdate this to matches made prior to May 4th. So here we're just talking about, lowering barriers, things that we've already talked about and have been covered in earlier webinars. And we can see here that we want housing providers to really lean on the HUD waiver that has been provided. Next slide. And that's it for me.
Great, thank you. It's Nicole again. So I just want to go through a few more slides and then we'll pause and see what questions people have. So as part of the COC board policy that was passed a few weeks ago, they authorized the project prioritization work group to consider some criteria for HUD Continuum of Care NOPA ranking. And that criteria is a demonstrated willingness and best effort to continue housing people during the COVID-19 crisis. And we're trying to accomplish this objectively through the use of data. Next slide. So we will provide a lot more information about how we are going to pull these data points in the near future, but we're looking at bed utilization rates, timeliness standards, time from match to housing, openings without a match request, and again, we'll share more about how that's going to be pulled so that we can be transparent and open about that process. And then every COC agency, so COC-funded agencies, should have received an email regarding the accountability plan for how we're going to roll all of this out on April 27th. And that email asked you to complete the agency acknowledgement survey, just saying that yes, you know that this is this accountability plan is going into effect and that you're committed to working with us on it. It was recommended that we do this by our spec work group to ensure awareness, which we thought was a great idea. And after May 8th, if we have not heard from all the COC agencies, we'll follow up just to make sure and touch base. Next slide. Great, and then just a few reminders about some efforts that are under development as part of this expedited housing initiative. We're also doing a huge push to have a more coordinated landlord engagement strategy. This has always been in the deck of cards for the system, and All Chicago has been working on it, but we decided to sort of fast track a lot of the pieces in an effort to help with this expedited housing initiative. So we are currently conducting landlord outreach through phones. We have a landlord survey. We're creating a centralized housing availability list, and soon we're going to make that list available to everybody. So you will no longer need to have your own housing location services, but if you do have them, they can plug into this effort and help us build out this process. And to do that, you can email cocprograms@allchicago.org. We're working to identify resources for landlord risk mitigation funds and holding fees, which we know will be helpful, and hopefully that'll be able to be used by everyone throughout the continuum of care too, depending on how much money we're able to raise. And more information, we'll try to bring more information each week about this. Next slide. So last week we talked about our next steps from All Chicago, and you can see here we're checking off the things. I'm sure there'll be more boxes on the slides as the weeks go on. But we are going to be turning now to increasing the usage and flexibility of bridge housing and rapid rehousing. So we hope to be able to share more information on what that process looks like in the coming weeks. And then we are continuing to support any effort that reduces system-wide barriers to housing. In some cases that looks like technical assistance calls from All Chicago with agencies to just put them in touch with the right people at IDA or CHA. We're hoping to have a lot more clarity from IDA and CHA and the Low Income Housing Trust Fund, as I mentioned earlier, about what they're willing to and able to relax in terms of documentation requirements. So those are some of our next steps. And if we look to what's on the horizon, I know the COC implementation structure or action agenda is really doubling down and kind of reinvigorating conversations around our efforts related to diversion, as well as employment and income. And we will yeah, that's okay, Torlin. You can keep moving while I talk, and then we'll wrap up. I will put in the chat box a resource that the National Alliance to End Homelessness pushed out in conjunction with the Center on Budget and Policy Priorities, and it's basically like a roadmap for everything that continuums of care should be doing in terms of immediate, short-term, medium-term, and long-term actions. And we're asking the COC Implementation Action Agenda team to be looking at this and figuring out how do we start thinking about the medium term and longer term things that need to happen. So we encourage all of you to read that and join in the action agenda as well. Great, so I think we can flip through the next couple of slides quickly. They're mostly just resources and our traditional wrap-up slides, and then we'll pause and see if there are any questions that haven't yet been addressed in the chat. Maura, did you see any come through?
We have like amazing rapid responders on the chat. So there's two that I don't see yet answered, so I'll start with one. Is the HUD waiver only for documents such as state IDs and social security cards because the offices are closed, or other documents? Or can we use other documents as verification of disability and the third-party homeless letter? Yeah. So do you understand that question?
I think so. I'm not the right person to answer it, unfortunately, unless I can see if Karen's on the line or if anyone else knows they can put it in the chat. I definitely have not been deeply involved in all of the HUD waiver items, but I will get an answer to that and we can respond to the person directly.
Okay, and then there's another question about, will All Chicago be including ATAs in the conversation about the data that you'll be pulling to ensure that these data points will be something that agencies are able to monitor through their reporting so that they can monitor progress?
That's a great question. So we actually have an HMIS line of work within the action agenda, and so we usually try to use the action agenda as much as possible when making those types of decisions. So let me check. On Monday is when we're pulling together that project management team, and so we can share more information about that next week.
Okay. See. That is all that I'm seeing that hasn't been responded to on the chat. So I think we're all set. And if people have additional questions, feel free to reach out directly to All Chicago or DFSS or CSH for coordinated entry.
Great. Thanks, everyone. See you next week.
Thank you.